When a deep cavity causes an infection in the blood and nerve supply of a tooth, a root canal procedure may be necessary to treat the infection. As a result of this deep infection, the tooth can become severely painful. Depending on the severity of the infection, you may experience varying levels of pain and may require more than one visit, not including follow-up visits. A root canal procedure involves gaining access to the root by entering the canals from the crown of the affected tooth and removing all of the decayed tissue. Each tiny canal is then identified, cleaned, and disinfected using small, narrow instruments called files. Once completed, the canals are further prepared using rotary instruments that open up the canals to a precise taper and length. A flexible plastic material called gutta percha is then used to fill each canal, sealing it and protecting it from damaging bacteria. To add structural stability to the tooth, the canal spaces are further prepared to allow for the placement of reinforcing posts. The posts are then carefully placed in the prepared space as a dense filling material is inserted into the tooth cavity. The core filling is then reshaped to resemble the biting surface of the tooth and cured to hardness using a specialized blue light source. To limit the possibility of breakage or fracture of the tooth after the procedure, a dental crown is highly recommended to be placed onto the tooth, which is often done immediately to complete the process.